Live on KETK. Well, every day on average, someone suffers a stroke every 40 seconds. It's the #4 cause of death in the U.S. and the leading cause of adult disability. Well, joining us to discuss strokes is Dr. Allison Hennigan with the ETMC Neurological Institute. Welcome.
Thank you very much.
Hi. Okay, so first off, how does someone know they're having a stroke?
So one of the ways that they know they're having a stroke, there's a term called FAST, which is look for face. Someone can look and see if the face is asymmetric. Have them raise their arms. Does one arm drop? That's a sign of a stroke. And speech. Have them say a sentence, and are they speaking clearly? And if they are, any one of those things is abnormal, then that could be a stroke. And the last letter is T for time, meaning the sooner you get to the hospital, the better off you are.
Well, what are some of the risk factors for this then?
The biggest risk factor is high blood pressure. High blood pressure, high cholesterol, diabetes, and smoking are all huge risk factors for stroke. They're very similar to the risk factors for heart attack. And what happens is they cause changes in the blood vessels that lead to clotting off of those blood vessels.
Well, we were talking earlier, and I was going to say a lot of people group the stroke, heart attack in the same category. So how do you, is it difficult to tell the difference then? I mean, what are you looking for?
So the heart attack is much more chest pain, nausea, sweating, and those kinds of symptoms. So it's a clotting off of the blood vessels in the heart, as opposed to a stroke, which is a clotting off of blood vessels in the brain and causes focal problems, weakness, numbness, difficulty speaking, difficulty walking. It can also cause nausea, but from a different perspective, a different reason.
What are some ways that people, can you really manage this? Can you prevent this from happening?
You can work towards preventing it. There is nothing that is 100%. But preventing it from happening with controlling high blood pressure, controlling diabetes and cholesterol, and sometimes just an aspirin a day can be helpful. An 81 milligram aspirin a day.
Yeah, I was going to say, because we were just talking about that, a study just came out saying that that's a good idea. So you do advise that then?
Depends on what your other risk factors are, but it usually is a fairly good bet that it's going to provide more benefit than risk.
Okay, and real quick, so you're with ETMC and you guys offer a treatment for this, a specialized treatment.
Yes, of course. The sooner you get to the hospital, the better we can treat you. The first treatment is, of course, always TPA, which is a clot-busting medication, but sometimes that's not enough. And so when that's not enough, we have people who can now go in and remove that clot with something called interventional radiology. So this is a very, what we call user-dependent. So the quality of your technicians is essential to having a good and successful program, and our people are wonderful. So they are excellent, and it is something that is offered now in East Texas, and we are very grateful to be able to have that.
Ability. Well, I was going to say, because you're saying, you know, one of the things you need to do is go to the hospital. Do a lot of people not go to the hospital? That's not their first instinct then?
Correct. That is not their first instinct. Some people will say, oh, it'll get better, I'll just sleep on it, I'll be fine.
That'd be me. I'd be like, hopefully it'll be okay.
It'll go away. It'll go away.
Yeah.
But even if it does go away, there's something called a TIA, a transient ischemic attack, and we can help assess those risk factors to determine what else we need to do to help control them and prevent a big stroke from happening.
Okay, thank you so much, Allison.
You're
Appreciate
welcome.
it.
Thank you.
Well, up next.